one of the great hospitals in America, if not the world. Central DuPage Hospital and, of course, Northwestern Medicine as well. Good morning, Doc.
Steve, I just have one thing before we get started. For the mental health of your listeners, would you please stop the Thanksgiving jokes?
Oh.
We've seen an increase in the emergency room. Patients coming in with nausea. We thought it was food poisoning, and they said, no, we've just been listening to Cochran for the last half hour.
It's jokes.
Let me tell you something. Let me tell you something. If I stopped what I was doing every time a listener complained of nausea, I wouldn't have a show.
You wouldn't have a career. Am I the only person that appreciates the jokes, Steve? I think I might be.
Yeah. Well, you love a good dad joke. These are all, again, from USA Today, so blame them. Doc, what is our number one medical concern right now?
Well, I guess if you look, globally, are we still looking at what's going on from an infectious disease point of view going forward? And, I don't want to beat COVID up anymore, and I don't want to beat influenza up, but really you're coming into the Thanksgiving holiday. So I would just say one quick message. Please, if you haven't gotten your flu shot, please get it. Our flu numbers are still fairly low. The hospitals across America would love to not have a triple-demic this year and give the staff a little bit of a breather. So that would be my biggest thing. And again, I hate to keep going with infectious disease, but that, and we can always talk about daylight savings time because everyone's complaining about that.
Yeah, no, I'll segue into that. But first, there is good news to report on next year. And you go, what are you talking about, Steve? It's the combo COVID flu shot that they put in a Slurpee or a smoothie.
Yeah,
You can do the
really
combo
is.
shot.
I think there's going to be some really exciting things next year, and you go, well, you're a geek, you think that that's exciting, but, we've talked to people about, well, should I get my COVID shot and my flu shot at the same time, and, it's been proven that you can, but I think the biggest thing is let's just get it into one shot, and you have Pfizer, Moderna, BioNTech, Novavax, all of them working on combo shots right now, and probably the good news is that they play well in the water. In other words, they're in one shot, they don't interact with each other, they give a great response, and the only thing we haven't heard about is the side effect profile, so we expect to hear that shortly. But wouldn't it be nice to just get one shot?
Yeah.
And who knows? The flu mist really for COVID is being tested as well. Wouldn't it be nice to just get the one flu mist? We talked about that last week, Steve, when we had talking about the opportunity to eliminate the needle for those who are needle phobic.
Let's look the other way. But talking about flu and COVID and RSV, oh my. Dr. Morse, they're saying that the CDC is now upping their surveillance or tracking of these viruses at airports because of holiday travel. So what is it? You're coming off the plane and someone just sticks a swab up your nose?
Well, I think, Jane, it's going to be interesting to see what they do. Are they going to put the temperature monitors back in that we've had for a long time and start tracking people's temperature? Mm-hmm. Are we going to ask people, to not, it's very difficult because once someone has to fly and they have what they think is a cold, which COVID can kind of feel like a cold now for someone who's highly vaccinated, we're going to have to do some other objective monitoring. And I think what you'll also see is you'll start to see more tracking here. Right now, the only tracking we're doing is wastewater tracking. So we've gotten out to, I can't tell you how much is in the community. I can tell you that it's in the community because we tested wastewater, but individuals are testing at home. Some are not getting treated. So really, we don't have a good grasp on how bad the COVID numbers are right now.
As we go forward with this, you mentioned daylight savings time. Somebody was asking, you just got back from Italy, a bunch of people have said, I get jet lag. I don't know. I'm tired all the time. I don't know if I have jet lag. But daylight savings time, there's a whole litany of things that seem to be related to it. I don't want to, people who really deal with problems from this, I don't want to poo-poo it.
I think you're
but I don't
exempt.
get it.
Yeah, I don't either. Just get used to it. It's only 1 hour.
Well, that's the biggest thing is that it's just 1 hour. So certainly you're going to have the shock to the system because we're losing a couple minutes every day, and then all of a sudden, boom, you lose 60. So, your circadian rhythm is kind of thrown off as far as when you're going to go to sleep and when your body's going to start telling you, hey, it's time to get ready to go to sleep. So certainly we'll have that. And people feel a little groggy, a little sluggish for a day. Probably the biggest thing is the people with seasonal affective disorder. And that's a true diagnosis where we use light therapy, use other medications to kind of treat that because they get depressed because of the decreased amount of sunlight. And then probably the other big thing is we're not going to be outside as much, so we're not going to get that natural vitamin D that we get from sunlight. So putting vitamin D back into your diet as a vitamin supplement for the winter, I strongly recommend.
Should folks get their vitamin D tested when they do a blood test, say that their annual checkup, because you don't want to overdose on your vitamin D? I mean, overdose, but you know what I mean. Take too much.
Yeah, absolutely. And I think that there are very few people who have high vitamin D. So certainly if you have a test done by your doctor for vitamin D, I'll tell you the vast majority of them are going to be low. They're going to then give you kind of a boost to get it up there because it's one of the vitamins that's actually stored in the body. Vitamins D, E, A, and K are stored in the body. So we want to make sure we have enough of it because it's so important for not only our immune system, but for our bone health. So we certainly want to make sure that we have enough vitamin D to maintain our bone strength and then also to keep our immune system up.
Vitamin D, how much?
It really depends. Individuals can take a whole bunch of it, or you can take, just one. I would say just really go to the vitamin D aisle or go to the vitamin aisle. You'll see the capsules there, 50,000 international units, whatever it is going to be, and it'll tell you exactly on the back based on your age and weight of what it should be.
Okay. And the supplement-specific vitamin D is better than the multivitamin?
No, I think if you take a good multivitamin, and people say, multivitamins are worthless. And I say, yeah, if you eat a great diet, a great balanced diet, multivitamins are worthless because you should get all your vitamins through a normal good diet. But I'll tell you, how many people have 3 servings of vegetables, 3 servings of fruit every day? Yeah. They certainly don't.
I mean, other than me.
We expect to get those vitamins.
Because you get an A. Dr. Most, I always like to say, modify your diet with your supplements, multivitamin, omegas, and D, vitamin D, MOD. What do you think about that?
I think it's good. The multivitamin, great. The omega, great for your heart health. So certainly is very important for individuals who are at any risk for heart health. And then vitamin D, I think it's one of the vitamins that we don't talk about enough, and that plays the importance. Look at how many people have osteoporosis in this country. Look how many people fall and fracture their hips due to a weakened bone. So certainly we want to make sure we maintain that bone strength with vitamin D and also with exercise because your bones have to be told they need to be used in order to maintain their strength.
Coming up, news on your lungs, news on your eyes, and red dye number 3, which was a band I was in. Stand by for that. Dr. Kevin Most, Chief Medical Officer, Northwestern Medicine Central DuPage Hospital, a good friend and a great doctor. That's the bottom line there. All right, Doc, so somebody texted in, Steve, as a matter of fact, from Tinley Park, and says, what about sun lamps? If I'm outside enough in the winter, then do I still take vitamin D pills, and should I factor in the sun lamp thing?
Wow. I mean, interesting question. So if you're outside during the summer, certainly you're getting enough vitamin D for your daily use. It's not like you're going to be out there and store up enough that it's going to get you through the winter. So I would say I would certainly recommend taking the supplement. Now, when he talks about sun lamps, it really depends. Sun lamps I look at as if somebody's trying to get a tan, and if it is, I would say stay away from those. But if it's the same lamp that you're using for seasonal affective disorder, there will be some vitamin D that's processed there.
Mm-hmm. But that sun lamp thing does work for some people, right?
For seasonal affective disorder, it certainly works.
Okay.
Yeah.
Right.
There's a story out about over-the-counter eye drops. I think most people at one point or another are popping eye drops. It can become habitual, but what do you want us to look out for?
Yeah, this is a big one, and a lot of people use these, especially as you age, because a lot of them will use them as natural tears or eye lubricant. You'll probably see that because we don't make as much tears as we age. But there have been 27 different types that have been recalled because of potential contamination with a bacteria that is very strong. So I would say, please, if you're using eye drops currently and you've had the bottle for a little while, go online, Google eye drops contaminated. It'll come up with the 27. If that is one of them, get rid of it, and then talk to your doctor about using a single use, or ask him or her what ones have been back on the approved list, because it's kind of serious. So, and if you have any symptoms of it, if you have eyes that are red, if you have crusting, if you have drainage, if you have pain, please get in because the infection that this could cause is pretty serious.
Let's talk about red dye number 3, because I remember when it was in cosmetics and then it was banned from cosmetics, and now it's banned in all of California, but it's found in literally everything. If it's so bad for us, why is it not banned everywhere?
Jane, you're asking the question that so many people have been asking for years. And like you said, in 1990, it was removed from cosmetics. And the reason it was removed from cosmetics because they did some lab tests and found that it caused cancer in rats. Well, they extrapolated that further, and it didn't show that it caused cancer in humans. However, we do know after numerous studies that it does have behavioral issues with kids, mainly causing hyperactivity. So, yeah, it's very interesting what Gavin Newsom has done here recently. If you remember, just a couple weeks ago, we talked about that he banned menthol cigarettes and flavored cigarettes from California in the hopes that he slows people from starting smoking as well as from continuing smoking. And now with banning red dye number 3, like you said, it's in so many products. It's going to be very interesting to see how they do that in California. But again, he's looking out for the health of his constituents to say, why are we giving something to kids that we know could cause hyperactivity?
And it sounds ridiculous to say this. Is there a red dye number 3 lobby that is keeping this from happening?
There should be.
Yeah, it's not so much the red dye number 3 lobby, it's the food industry lobby, because the color of food is more to attract people to that food, right? They want to make it more eye appealing and make kids more anxious to take, not anxious, but willing to take something. Mm-hmm. So it's the food industry, because now what they have to do is reformulate all their food just for California, or start to sell the food that they sell in the UK and Canada and Australia, where red dye number 3 has already been banned.
So why don't it just seems easy enough? Why don't we just substitute what they're doing in Europe and do that here? Because it's in food, snacks, candy,
your
frozen.
Common sense and good ideas in here. What are you doing? We're talking about the government.
Or make it not red.
Yeah, absolutely. I mean, I think you're going to either have to see these businesses are going to have to say, wait, we're just going to give this up now and just get like the rest of the world. And most of the large food companies are global companies anyway, so they're already making these products without red dye number 3. So I think they think it's going to hit their bottom line, and they think that they've proven that it's safe and doesn't cause cancer, but they still can't come back and say that it does not cause hyperactivity in kids because it's been shown in numerous studies.
Last thing is new guidelines for lung cancer screening. This is important for everybody, right?
It really is. You know, it's interesting when we started doing lung cancer screening with CAT scans, and we said, hey, if you've smoked 20 pack here and you're between the ages of 50 and 80, you should get these done as long as you've quit within the last 15 years. Well, the premise was totally wrong, because the premise looked at it, the further out you got, you decrease the chance of you getting cancer. And what they've actually shown is that doesn't decrease. So what they've essentially done is extended that screening, which is really important, especially for someone who smoked when they're young, are still in the middle of their lives here. And as we know with mammographies and colonoscopies and skin exams, the earlier we catch cancer, the more treatable it is and the more life-saving it is, and that is certainly the case here. So really, if you are a smoker and smoked 20 pack years and have quit, it's time to start getting screened, because if we catch that cancer early, we'll save your life. Dr.
Kevin Most.
Super important.
Very, very important. Mm-hmm. And again, get your flu shot. It takes 2 weeks for it to be fully effective. If you haven't gotten it, get it now. Flu season's here, kids. And you don't want it. That's all. Think about shingles shot, too. Yep.
Absolutely.
How much time again between a flu or a COVID and a shingles shot? How much time should you have?
I'd put 10 to 14 days. I mean, okay. A lot of people get the pretty significant reaction from the shingles shot, so I would certainly say, hey, get the COVID shot, wait a couple weeks, and then go ahead and start your shingles vaccine.
And again, you can fight me all day on this, but we know this. When you feel bad after a vaccination, it's because your immune system is turning on, because it's trying to recognize what's the strange thing you've put into the body. What you put into it is a dead lookalike, and your body will recognize that and fight it going forward. Look at me, Doc. I'm practically a medical student.
Yeah, it's pretty good. I tell people all the time. People say, "Oh, the shingles shot. I've heard so many bad things about it." I said, you know what? go find somebody who's had shingles.
Right.
Yeah,
They'll
right.
tell you
Exactly.
they'll take a shingles shot every day to
Right.
not end up with shingles.
And
Right,
that
right.
shingle shot is it was 97% the Shingrix.
Exactly. Shingrix is, 97, 98% protective. That's about as good as you can get.
Thank you for the info, as always. The great Dr. Kevin Most, Northwestern Medicine, Central DuPage Hospital. Have a great day.
You got it, guys. We'll talk soon.